The most important thing I would say to any woman is you know your own body.
Nobody else.
You know your own
Listen
body.
to yourself.
Keep a record.
That is amazing
record,
advice.
Right? Because the amount of women that go into a GP and they get flustered and they're tired and they're overwhelmed, and the GP is tired and overwhelmed as well, and they're trying to correlate their symptoms and they can't.
Yeah, no.
So the GP is doing their best and can only go on the information you give them when you go in and sit in front of them.
Correct.
But make their job easier. Make your diagnosis better. Write it all down and present it to the GP. Help them make a diagnosis.
Welcome to my podcast. I'm Tanya Corless, and today we're talking about the woman health, about endometriosis, infertility. And I have very, very important guest, Irina Scarf. She is in the Willow Clinic. If you have any questions, please ask.
Thank you for having me, Tanya. My name is Irene Scarf and I work in the Willows Clinic in Glasnevin. I came to the profession that I'm in basically due to my own health issues. I'm a practitioner, 32 years. I specialise in fertility reflexology. We also combine within our clinic, within one treatment, we combine fertility acupuncture and fertility reflexology within the same hour. We will do half an hour of each for the patient. We found combining both of those treatments got a much higher rate of viable pregnancies. I started the journey, as I said, over 32 years ago. Really, the fertility came to play when I was diagnosed myself with stage 3 endometriosis, which is an autoimmune condition. And there was very little information about it. At that stage, the only help you could be given as a woman was a hysterectomy or to go on the pill. And I had already had one child. I wanted more family, but I was having recurrent miscarriages. I'd had 13 miscarriages. I had 13 pregnancies. I had 11 miscarriages altogether.
Oh my God.
So there was very little help. But I was very lucky one day. A friend of mine has suggested I see Dr. Mary Wingfield in Holles Street, who's now Prof. Wingfield. Now, Mary has retired, but she was a lifesaver. When I went in, I asked her if she could help. I went through my background with her. She said medically there was nothing they could do. And I thanked her and I went to leave. And she asked me if I could please sit back down again. When I sat back down again, she said, there's nothing medically we can do. But she said, I'm going to be honest. She said, we've been waiting on somebody with your profile for a while. And I said, I don't understand. She said, we have been looking to set up a pilot scheme for women with this condition and other pelvic inflammatory conditions. What we wanted to do would see if you would be open to having a scan, having treatment of acupuncture and possibly reflexology, and we will rescan you again every 6 weeks to 12 weeks to see if the treatments are working. And I said I would agree to it on the condition that I will put the program together myself for the reflexology, because I felt like you cannot treat the same type of treatment every stage of the month. Because you have your follicular phase and your luteal phase, the treatments have to be targeted to that. So the follicular phase deals with the growth of the egg, and the luteal phase deals with the implantation or the building of the lining. And if there's no embryo to implant, the period will come on.
Okay.
But with endometriosis, and 1 in 10 women have it, that's the statistics. I think looking at the clinic, the way we were listening and running it the last, as I say, over 30 years, those statistics are wrong. It's much higher. And unfortunately, we're seeing a lot more young women coming in with issues in relation to chronic pain, hemorrhaging on the period, heavy blood clots. And the reason that is yes, conditions such as PCOS and endometriosis, but also we're seeing a huge increase in the imbalance between the estrogen and progesterone in their actual system. And a lot of that is down to very poor diet and misinformation about diet. And diet that's high in estrogenic foods like sugars, meats, alcohols, rather than what we call a clean diet, a more plant-based diet. So when I started to work with Dr. Wingfield, we noticed a significant improvement in my symptoms. Then RTE came out and asked if we could cover the program. Wow. And I'll be very honest with you, I said no. Why? Because it was very personal.
You wasn't ready
we're talking
for it.
about the early 90s, 94, 95 at this stage. And
I
like
wasn't ready for it.
women didn't talk about miscarriages, periods, fertility issues, let alone going on national television and disclosing.
Absolutely, yeah.
So I
I
said
don't understand
no.
why. I don't understand why, but still kind of.
But then a few weeks later, Mary asked me to go back in. I went back in and she said to me, I understand where you're coming from. But she said, do you remember what you said to me when you came to me first? And I looked at it and I went, give me the contract. What I said to her was, use me as a guinea pig. I'll do whatever it takes so another woman doesn't have to go through this hell.
Oh, fair play to you, my God.
So it was hard because, again, I didn't want my personal life all over national television, but it was. But I didn't say it to anybody really. My family knew. My husband wasn't happy about it, and I understood that. I remember saying to him, but why aren't you happy? Please explain to me why. Why are you not happy?
Yeah.
And he said, well, I don't want the fellas in work seeing this and all our personal business. And I said, you know what? If the fellas in work are looking at this program, they're looking at it because they're looking for information for somebody close to them. Maybe
Exactly.
a mother,
Who's
a sister,
come
a
across
wife,
that?
a friend,
Yes.
a cousin.
100%.
They're looking for information. And if we keep hiding, how are we going to help? But the issue that I have experienced time and time and time and time again, and it's infuriating for us to see this, is the lack of information that's out there. Everybody assumes that a man and a woman knows what goes on in their body.
No,
Why?
unfortunately.
Because we've Google.
Yeah,
so
Google.
everybody's supposed. But guess what? They don't. And there are times in the clinic when we have to sit down with a patient and literally go back to basics and explain. Because they were too embarrassed to put their hand up in class and ask a question when that subject was covered.
True.
You know, and
That
they
is
don't.
true.
If I say to a woman, do you know when you're ovulating? Well, what exactly now is that? What's happening there and what does that mean? But so we failed them. We have failed them because we need to be able to say to women, look, if you need to talk, if you're not sure, and I say this to women all the time, if you're not sure about it, just ring me. It's only a phone call. But we've got to help to educate women and young men. I mean, as I said earlier to you, we spend in Ireland our teenage years and our 20s mostly on our knees praying we don't get pregnant. We spend our 30s and 40s then praying we do. Because everything is shut down, closed down, don't get pregnant. And then it's time to get pregnant, have babies. And it's a full flow ahead. And you're like, oh my God, where do I start? Why isn't it happening? I've been trying months. Am I trying at the right time? Do we have to have sex every night? If you have sex every night, does it affect the quality of the sperm? And these are all things that have to be discussed and explained. So first of all, no, you don't have to have sex every night. But it is important that your partner ejaculates every 2 to 3 days to help to keep the sperm fresh.
Okay.
It's also important that they have a well-balanced diet. It's also important for a lad that he doesn't go around in a very hot environment and his clothes aren't hot. So heavy jeans or heavy work clothes, that when he comes in, he has a shower, he gets into loose, comfortable clothes to let the crown jewels breathe, to allow a circulation of blood. That's very important. It's equally important that he's not knocking back the pints all the time and putting his liver under pressure. Because the liver has a huge job to do with fertility, as does the kidney.
And you wouldn't think about that.
No, they don't. And why would they? Nobody's explained it to them. They just assume, well, like, right, we want to try and get pregnant. We'll try. It'll be happening in a couple of months.
Yeah.
And then when it doesn't happen, it's heartbreaking to see a couple coming into us. And when the issue is falling on the side of the lad, I've let her down. I've said, it's heartbreaking. But the beauty of it is, with the lads, the tendency is it can be sorted quicker and easier. And that's the reality. You know what I mean? It takes 3 months for good, healthy sperm to replicate.
But Irene, can you say, for example, if you said so many young women back to you with endometriosis and infertilities, would you say it's because, maybe not, I'm not a doctor to say that, our girls who are just turned 12 years old or whatever, the start period on, mothers, most of them mothers, will bring them straight away to GP and with no any other reason that not to get pregnant randomly. So they put them on the pills. Maybe that would be affect them in the future. The infertility issue came from that part too. Maybe not. But I didn't find the proper research that will prove it. I was check this. But at the same time, I was thinking the girl who just started developing and maybe the period only started a year or two is still not enough.
I agree.
the system not
the body
ready.
hasn't regulated.
Exactly.
The hormones haven't
It's
regulated.
take ages before it will be put in the
Yes.
correct way. 5, maybe 10, depends on the person. And when there starts this pills too early, probably will affect them in the future. Not all of them, but some percentage probably affected from that point too. Maybe not. You in this field, you'll know better.
There's a dichotomy there. First of all, I would fully agree that a child being put on the pill for the sake of fertility, if the mother's afraid that she's going to get pregnant, and if her hormones haven't regulated, yes, that'll be an issue. If a young girl or a young woman goes to the doctor and they're having very heavy periods and they're bleeding out every month and they're losing a lot of iron and they're struggling,
It's a difference.
And the pill is good in the sense that it will stop that immediately.
Yeah.
So with endometriosis, what actually happens is when you bleed every month, all of the blood is supposed to come away. With endo, it doesn't. So for argument's sake,
Clots.
there will be a percentage that doesn't. So that percentage that doesn't will do two things. It will build up on the lining of the womb and start to form lesions and adhesions. It will also go outside the womb and go behind the womb into what we call the cul-de-sac. It can also go literally like chewing gum and start to attach itself to the bowel and start to pull the bowel out of shape. So rather than that happening, if somebody's on the pill and they're young and they're not thinking of family, they want to go through college or they want to travel or whatever, the pill is ideal because it stops that bleed out every month. Right.
Okay.
And it stops that feeding of that. Because once the period comes on every month, those lesions will rip and tear and pull and you get more there. And it's really uncomfortable.
Right.
You know, so the pill will be good in that sense.
It's affects the whole life, to be honest, for women if they do
Yes.
have endometriosis.
But what they have to look at with endo is, again, it is closely connected. It is estrogen dominant. We know that now. Like 30 years ago, we didn't know. We just knew 1 in 10 women had it, but we weren't sure why. Now we know with PCOS and endo, it's predominantly estrogen dominant. Now, the only conclusive way, and Dr. Kennedy and I and a couple of other practitioners, the last fertility conference prior to COVID in 2019 in Crow Park, we were asked to talk in a panel about endometriosis. But the one thing I wanted to hammer home to the audience was there is no full, proper, conclusive way of diagnosing endometriosis except a laparoscopy. You can do a scan and you can see a little bit, or you mightn't see it there and it could be around the back. So the only conclusive way is a laparoscopy. So if anybody listening to this thinks they may have it, you need a laparoscopy. And also I want to clarify, there is a huge misconception with endometriosis. You can have stage 1 and be on your knees every month. You can have stage 4 and not know you have it.
It depends on woman.
It depends. So there is no hard and fast. It's not like, well, she's broke her leg or he's broke his leg, so it has to be potted. It isn't like that. So if any young woman or woman thinks that she has it, she needs to go to her GP. She needs to explain her symptoms or her fears. Again, I say she might have it and have no symptoms, but feel intuitively there's something not right and I want it looked at. A laparoscopy.
Can you give points that woman has to be maybe picked? How she feel, how she, what any other symptoms, flag those symptoms.
Sure. The flag symptoms of endo, those that are symptomatic. Now, not everybody is symptomatic.
Correct.
And that's the point I'm making. But those that are symptomatic will have normally heavy clotty periods, a lot of pain in their lower abs and their womb, even a week or two before, pain on ovulation. When the period comes on, it's very heavy, very clotty because of stagnation. So in Chinese medicine, we would say it's liver qi stagnation and it's spleen deficiency.
Yeah.
So there's a lot that Chinese medicine can do in relation to reflexology and acupuncture and herbal medicine. So when somebody comes into us and we've got a proper clinical diagnosis, we will treat those women if they don't want to go on the pill or they don't want a hysterectomy.
Okay.
And we would have a big part of our clinic will be treating endometriosis, PCOS and gynae issues. But they would, as I say, you will be tired, irritability, breast tenderness, general PMS symptoms, but aggravated and last longer than a few days. It normally will start from ovulation, not always, but the periods are very heavy, very clotty. And the pain in your womb, your abdomen, really
Terrible.
bad. And
Terrific.
that's because And especially for younger women who haven't had a baby, the neck of the cervix is closed. So this blood is thick, it's heavy, it's gloopy, and it's pushing through. So for a woman that's had a baby, sometimes it can be a little easier because the cervix is open if it's been a vaginal delivery, but they can still have very heavy periods. And they can still have very clotty periods. One thing I would say to anyone, whether I've got a young woman that's having issues with her periods or a mother whose daughter has just started her period, I would say go to the pound shop, cheap as chips, buy a few packets of the heat pads, and when you're in work or in school, put one in your tummy and one in your lower back. So the heat relaxes the womb, it thins the blood, and it helps the flow downwards. And then when you're at home from day 1 of your cycle to day 7, make sure you have a hot water bottle on your tummy when you've done all your bits and bobs and you're sitting down. But get a handful of castor oil. Now, people talk about castor oil packs, and that's fine. But sometimes life's too complicated. You're too tired. You don't have time to be soaking cloths, wringing out cloths. Put some castor oil in your hand. Rub it on from the belly button down, right across hip to hip. Put a hot water bottle on that has no cover on it and sit there. The castor oil will seep into the epidermis of the skin. It will seep into the womb. It will help to loosen the blood. You want all the blood flowing down and out.
Wow.
You don't want any blood staying in there. The other issue is a lot of young women that are using tampons. We find that tampons don't allow the blood all to flow. So they will have a percentage of the blood staying in the womb. Once they start to, because if I say to a woman when she comes in, how many tampons are you using? I'm using about 6 of the big super ones. Right, is there any clots in that? Well, not really. Then when we get her to change the pads and she has a bleed the next month, oh my God, I couldn't believe there was so much more blood, so much more came away, but I felt much better.
Right.
Because everything was coming away. And that's very important. You want a clean womb. You want all the blood to come out every month.
Yeah.
So the heat will help that. But you never, ever, ever, ever apply direct heat to the womb once you've ovulated if you're trying to get pregnant. Because again, heat pulls. So if there's a little embryo trying to embed in there,
it will be gone.
So that's very important.
No hot bath or
No
the
hot bath,
sauna,
no hot shower.
Sauna
From
is
day
well,
1
no
of your
sauna.
period up to ovulation, you can have a hot shower, a hot bath. Once you ovulate, it's very important that you maintain a good body temperature, that your womb is warm. So if you put your hands on and you feel cold, layer up in your clothes. But keep your feet warm. In Chinese medicine, we would say if the feet are warm, the womb is warm. So it's important to keep the feet warm all the time if you're trying to conceive. But also if you have issues with your periods and they're clotty and heavy, keeping the feet warm keeps the womb warm, and heat allows the flow of blood down.
Fantastic. Irene, so tell me about the clinic. What exactly you are doing this? For example, woman came to you and says, okay, I have problem with my infertility. So what you doing? What is there?
Okay.
Exactly.
First thing we do, we would do a full consultation. So I will go through her medical history. I will go through her menstrual history. And then I will check what blood tests she's had done, what tests she's had done. Then if, like a lot of them will come in and they say, well, I haven't really done anything. So we will give them 2 lists of bloods to get done straight away. Day 3 bloods and day 21 bloods. Day 3 bloods will give us an idea of their follicle stimulating hormone, their luteinizing hormone, and their estrogen. We will have other bloods in that, but those ones have to be done between day 3 and day 5 of a woman's cycle to optimize. Those will give us an idea of the growth of the follicles, her hormone level, to see if the luteinizing hormone is rising enough that she will actually be starting to get ready to ovulate. Then when she has ovulated, 7 days later, we will ask her to get what's called a day 21 bloods or progesterone blood. Day 21 is a common term that we would use, but we will clarify with everybody, it is actually 7 days after you've ovulated.
Okay.
That blood will tell us whether you've ovulated, that blood test, progesterone bloods, and will also give us an idea of the level of blood in the womb. Okay, that month. We'll have an idea, oh yeah, right, that's a good enough lining. So if you got pregnant, you would actually have a better chance of implantation of the embryo occurring. Where if it was a low count, we'd say, well, that's progesterone deficient and we need to work on that and build up your progesterone. So they're the first lot of bloods we get done. We'd also then recommend a hycosi, or some people call it hysteroscopy. And basically that will be a day procedure. And it just checks if somebody's been trying for a while and they haven't had any pregnancies. We'd want to make sure that there's no issues in the fallopian tubes, that there's no debris, there's no blockages. So they would put a dye through the tubes to check that.
Okay.
So that's important. We would also get their partner to check their what we call a sperm analysis. So that's the motility, mobility, and morphology.
Okay.
So that's the count, the amount of sperm they have, the fluid the sperm is actually in, and the shape of the sperm. And again, it's very simple. It's just you go into the hospital, you ejaculate, and you'll have the results in about a week to 2 weeks. But again, that gives us an idea, because we are seeing a huge increase in male fertility issues compared to 10 years ago.
Wow.
And we really do believe it's down to diet, lifestyle, much more exposure to laptops on the lads' laps, phones in their pockets. If they're doing sports that are very heating, like cycling, we do see a correlation with all
Men,
of
be
that.
careful.
Yeah, men be careful. Men be informed. Men know.
It's not
You know
only
what I mean?
woman issue. Sometimes it's
No,
only
yeah,
also involve man issue
we would
too.
always look at
Less
both.
percentage, but still there, still
but
exist.
but getting higher in the percentage.
High and high every year.
That's the issue.
That is kind of a
You
very
know, and that's
dangerous
it.
then.
Yeah.
Women who come across this issue, stage 1, stage 2, stage 3, as you explained. So are there still have opportunities to have get pregnant naturally, or it has to be only from their...
No, I got pregnant naturally, thanks to Dr. Wingfield and the program
Okay.
she set up, and that we then developed between the fertility reflexology and the fertility acupuncture.
Fantastic.
The reason that happens, and the reason that it's very good and it helps and it can treat this condition, is you are reducing the inflammation. You are, in Chinese medicine and reflexology, you're working on the endocrine system to balance up the hormones, and to get the hormones to do what they need to do.
Right.
And to get everything to move. Because with endometriosis, it's stagnation, it's cold. So simple things like the heat on the feet, the heat on the womb,
still for 'em.
that helps to move things. But the treatments themselves break down adhesions. They have been known to break down adhesions and lesions and to move things. And then we would look at the diet, then we would look at herbal medicine, and we'd look at supplementation. So it's a whole program. And we would have to tailor that individually to each woman that would come in, because it isn't one size fits all.
Okay.
Because we're not all one size fits all.
That's true. That is
You
true.
know?
We're all different, and we
Yeah.
have different issue, different
Yes.
reaction. Our body react differently on different treatments.
Yes, exactly.
How often, from your point of view, from your experience, women, young girls maybe, who starts having sexual life, call from this way, seeing the gynecologist, how often? Every 6 months? Once in a year?
Once a year.
Once a year.
Once a year. And if they've any sort of inflammation,
Issues.
discharge, and go straight to the clinic, go straight to a Well Woman Centre or an STI clinic. The one problem that we are seeing, and well, I'm going to be honest, this is the way it is. So
Yeah.
we need to just say it as it is. There was an American study done, and they were absolutely horrified, and they realised there was a huge increase in the spread of gonorrhea in a very young age group. But they were all having oral sex. There was no penetrative sex. So again, they don't realise once you have fluid and saliva, it travels. So this age group are thinking, well, we're okay because we're not having penetrative sex. So, and that can be in your system and lies dormant, and you don't know until such time you decide you want to start a family and you go for investigation, and it's too late. So the point you made there is an excellent point. Women need to go and have a full sexual health screen and get the hormones checked at least once a year.
Even if you have no symptoms.
Yeah, because you
Just
don't
in case,
always have
yes,
symptoms.
yes,
Exactly. And the other thing
It's very
is
important. We need to remember that.
the other thing is there is a huge issue that women they're aware of here, but they're not aware of it here. And it's your AMH, your egg count. So some clinics are now saying, oh, it's not relevant. But to be honest, you have a certain amount, and each month when you have your period, you will lose a certain amount.
Okay.
So it's important, just in the back of your head, if you do think that you want children, not to be obsessed with it, but to be informed. So you can make an informed choice in relation to timing.
What's going on.
So your AMH, you'll get that done. Your GP can organise that for you, no problem. And that will give you an idea of what your egg reserve is. Again, you're not coming to the table at 35 thinking, oh, I should be fine, and realise, oh, Lord, it's dropped off the cliff. You know what I mean? Now, we know from the age of 35 the AMH does decrease. But we've also had women in their early 40s who their AMH is, you'd be surprised, it's not bad.
Not bad.
But it's just to make informed choices. educate yourself. Take control of your own health. Don't be waiting on other people to step up.
So we talk about before what medication, but think about what nutrition you have to take. And
Nutrition
again,
is huge.
Huge. But you need to remember, you can't follow that your neighbor says, oh, I was taking this nutrition, it's working for me, try. Yes, you can try, but there is no guarantee that those nutrition will be work exactly same and help you. And maybe it'll make you damage.
It can, and that's why it's so important.
It's very important.
I know from our herbalists when they're putting a prescription together. I mean, we have to know so much about the individual. We can't say,
as well.
oh yeah, heavy periods always get. No, it's not that simple.
No,
because it could be issues with the spleen, it could be issues with the liver. Do you know what I mean? Kidney. So, and we have to see which is the dominant one and whether it's stagnant or it's overactive. There are so many issues. So that's why you wouldn't just do one size fits all, because it doesn't.
So if you, for example, gone through all this procedure, you got pregnant. So it doesn't mean getting pregnant that all this condition endometriosis gone. So probably will be back again to you in a while.
Yeah, once you get pregnant and the pregnancy holds.
Yes, all fine.
You're not bleeding out every month. The blood is going to the placenta.
Yeah.
So most women will get a reprieve. Okay. So they won't be in as much pain.
Right.
But sometimes, and I experienced it myself on my pregnancy with my son, sometimes as the baby is growing, if there's old lesions and adhesions there, it'll stretch and you'll be a bit like, oh, that's sore.
Yeah.
You know what I mean?
Okay.
But it's not being fed.
Right, okay.
And if you're breastfeeding and you're not coming on a period, that gives you more time. The most important thing I would say to any woman is, you know your own body.
Nobody else.
You know
listen to yourself.
Keep a record.
That is amazing advice.
Right? Because the amount of women that go into a GP and they get flustered and they're tired and they're overwhelmed, and the GP is tired and overwhelmed as well, and they're trying to correlate their symptoms and they can't.
Yeah, no.
So the GP is doing their best and can only go on the information you give them when you go in and sit in front of them.
Correct.
But make their job easier. Make your diagnosis better. Go in and have everything written down. So this morning at 4:00, I got a really sharp pain in my left-hand side. I felt nauseous. My breasts were very tender. My stomach was distended. Then the next day, my period came on, but I felt every time I stood up, I was hemorrhaging. You know what I mean? I was getting clots. What size are the clots? Were they a thumbnail? Were they like this small piece of liver?
Yeah.
Did the pain get worse or better after you got rid of the clot? How many pads are you using on day 1 of your cycle, day 2 of your cycle, day 3 of your cycle? Write it all down and present it to the GP. Help them make a diagnosis.
So, woman, when you have a period, you have to make your diary or calendar. This is you have from this day to that day.
If you're having issues.
If you have,
but
even if you have no issues, if
there's
it's
no harm. Yeah.
No harm to have the records, because
absolutely,
if you come across to any issues, doesn't matter, it's a small or big issues. Yes. So it will be easy to show the whole history.
So any practitioner can see your pattern.
Because you wouldn't remember.
Absolutely. No, you wouldn't. Why would you?
I don't remember what happened last week.
Absolutely.
Forget about what happened a few months ago.
Yeah.
Unless you come across situations.
And your pain scale, 10, you're doubled up, you can't get out of bed. So day 1 or prior to the period, really bad pain. On a pain scale, it was 9 to 10. By day 2, it had gone down to 7. By day 3.
Yeah.
Write it all down. Write down whatever you feel is relevant to you. What medication you took. Now, on medication, there's one thing I am glad to have the opportunity to say this. Women that are looking to get pregnant, be careful using ibuprofen and codeine. We know it damages egg quality. Paracetamol, obviously taken by the RDA, the recommended daily allowance, is safe in relation to egg quality. But ibuprofen and codeine particularly isn't. So if a woman has got very heavy periods, and they're brilliant for pain relief, I took them myself.
True. Yeah.
But just to be mindful that they do have an issue with egg quality.
But okay, so women get all this agony eventually in a position to get pregnant. They get pregnant. So they go in all this hustle. What about men part? Men who is just around this woman. They live together, family, whatever story.
It can be very hard for men, and people underestimate that. And the one thing that people really don't understand is if a woman's come in and she's had a miscarriage or a recurrent miscarriage, all the focus is on the woman. The man is trying, in the vast majority of cases, he's trying to be like a big lion. He's trying to protect her.
As well.
his heart's breaking.
Yes.
And everybody focuses on the woman.
Yeah.
And I understand that. But again,
Man
I had 11 miscarriages. So did my husband. He didn't go through the physical hell of the miscarriage. He didn't have to go to the surgery.
But mental round.
But, you know, they were his children too.
That's
And
true.
we have to respect that. And we have to understand that. We can't keep men over here all the time. Bring them in when you're in labour. Bring them into the war. Bring them in with the... But then when you're going through something like this, society sidetracks them.
No.
Do you know what I mean?
Yeah.
So if your friend, his wife has experienced a miscarriage, or your sister-in-law, or talk to the man involved. Talk to the husband. You come for a cup of tea? Do you want to go for coffee? Do you want to go? How are you? Are you all right? How are you feeling? You can't take the pain away. You can't wipe out that grief.
No.
But you can listen. You can be a sounding board. And somebody just acknowledging their loss, their pain, their grief.
That's
It's
true.
huge.
Huge.
And we have to do that. We're all talking about mental health and but do it with the basic stuff. Do it with your brother. Do it with your cousin. Do it with your pal. Do it with the bloke in the office who came in after 2 days, his wife having to go in for surgery for a miscarriage. Or they've been trying for years and they got pregnant and she's lost a baby. But they both got pregnant. They both walked that road.
Absolutely, absolutely. But would you recommend also for those type of couple who came across this terrific time to go to see somebody, therapist,
Absolutely.
who will talk to two of them at the same
Absolutely.
time, explain.
Yes.
She'll explain her feeling, he will explain his feeling, or whatever way they will operate.
Every
it
couple
at
is
the time.
different.
Correct.
A lot of men won't want to go for counselling. They see it as a failure. They see it that they should be strong enough to deal with their grief and help their women, right?
But it doesn't work like that.
It doesn't work like that. And that's why we're having this conversation. That's why you and I are talking about this now.
Yes, that's true. I do agree about that. But at the same time, if, sometimes men, as you said, I'm a tiger, I'm here to protect you, I'm just right beside you. But at the same time, men, this is everybody knows, not mentally strong enough compared to women. That's why women able to carry on the baby, have all this issue, and be able to
keep
move
going.
on.
And I get it. I was one of those women. I get it. There is a need. There is a need that you cannot explain unless you walk that road. You cannot explain
even as
to
the
another
woman
human
can't
being.
understand you.
No. There is a need that is in you that will drive you. That when you're coming out, and like any woman that's been to the state, you go in if the pregnancy is developed past a certain stage, and you have to have a D&C, and you wake up in that ward. And you wake up in that ward,
yes,
and
every
there's
day
babies
after,
all around you.
Yes, this is
crying.
disaster. This is disaster.
It's horrific. It's horrific. So not only have you lost your child, gone in pregnant with all the symptoms of pregnancy, and then you wake up after the surgery, and then you're subjected to this. Now, I totally understand. Our health system is on its knees. We all know that. And the practitioners and the nurses, and they're doing the best they can. And they're doing a bloody good job under very hard circumstances. But sometimes I would just love to say, please, just put them in the gynae ward. Just put us in the gynae ward. Please don't do this to us. This is horrific for a woman. Please just don't add insult to injury.
Okay, so we'll try to put the line. If you have any issue, don't afraid to ask the questions. Don't afraid to go to clinic, and don't afraid to meet so many people if you feel you need to meet them.
Keep asking the questions. Keep pushing forward.
Go to
Don't take
Willow's
no for
Clinic.
an answer.
Ask Irene. Call her. Don't afraid to feel that somebody maybe will feel that way. Or stupid questions. There is no stupid question.
There is no stupid question. Only the ones you don't ask.
Then don't afraid to take and try any other medication or treatment the doctor recommends you. Don't think you know better. Try it.
If you feel it's not for you, if you feel you're being recommended something's not for you, explain to your GP
and discuss.
Why. Have an adult conversation. Don't walk out of there thinking, well, I have the script in my hand, I have to get it filled. And don't not take it and go back to the GP and say nothing's working. You're not being fair to the GP because you haven't given something a chance. Accept responsibility for yourself.
Correct.
Go in and sit down. Bring as much information to your GP to help your GP to make an informed diagnosis.
Absolutely. So also you need to keep in mind, if you would like to get pregnant, be a mother, father, for both of you, you need to remember about the lifestyle.
Absolutely.
What you're eating, what you're doing. nutrition on top of that as well.
Absolutely.
So don't think it's a magic things happen naturally for, at the moment, most of us, but some of them are suffering. And if you're in that position, you need to think in advance. For example, you at the moment young to think about it, but you heard that some stories happen in your family by mother side or father side. Jen is still there. Don't think it will be missed you.
Absolutely. And ask questions about your family. Ask, is there any thyroid issues? Endometriosis, PCOS. Now, in fairness, PCOS and endometriosis wouldn't have been talked about much, except a lot of women wouldn't have been diagnosed properly up to maybe 20 years ago. So don't expect to know that your great-grandmother and your auntie's side had stage 3. That's not going to happen. But ask about your mum, your grandmother, your aunties, your cousins, things like that. About the lads in the family. Has anyone had issues with their partners trying to conceive? Don't be nosy, but just ask the questions. Try and build a profile.
To understand.
So you understand. It's not going to make a huge difference, but it just gives you an idea of, well, do you know what? We do have a history of diabetes in the family, or we do have a history of overactive or underactive thyroid. So, or there's a history of cardiovascular disease. Just get to know your family.
So thank you very much, Erin, to come over.
Thank you very much for having me. Appreciate it. And it's lovely to be able to talk about these issues. And hopefully, if one person hears this and if one person realizes, I need to take control here and I need to make an informed choice and I need to be responsible for myself, well, then we've done something. Okay?
Absolutely. Thank you very much. I believe it was very interesting conversations we had, and I will be see you again.
Please, God. And thank you for
Thank
your time.
you very much.
Thank you.